Friday up in Chicago, there was another protest against Governor J.B. Pritzker's move to limit the taxpayer subsidies for undocumented migrants or those seeking asylum in the state of Illinois. And he ultimately made that move the week before last week, saying that in order to control the costs that were ballooning more than anticipated, they needed to freeze the program for those migrants in Illinois 42 to 64, while the program for those 65 and up would be frozen if it got over a certain threshold of 16,500, I believe. So all of this costing taxpayers in the budget that starts July 1st, $550 million. That's the cap. And that's after there were projected costs of more than $1 million, or billion, 1 billion with a B. So the governor essentially slicing that in half to just $550 million in the state budget, and to control those costs, he's going to have the taxpayer subsidies limited to $550 million. He's also going to implement some co-pays for a variety of things. Well, we talked with State Senator Steve McClure on Friday, and he shared some of his thoughts about this, saying ultimately that this is all going to cost taxpayers, and the entire idea, it's just not sustainable, he said.
Yes, if you put money here, you don't have other money to go in other places. So in fact, that's exactly what you're doing. It's really frustrating for all of us.
He also talked about how Democrats, they seem to, pass things without realizing just how far things could go in the overall cost to taxpayers.
You don't necessarily think about what you're doing, and sometimes you get into things that you sort of start to realize were a bad idea, and I think that is reflected in the governor's decision to change the policy up a little bit.
So the policy changed slightly. Just some background, Illinois implemented taxpayer subsidies for migrants in the state undocumented in 2020. And that was estimated to cost like close to $2 million with an M. But then in 2022, they expanded that to include those 42 and up, and the cost estimated for the coming fiscal year to be over $1 billion with a B. And then the governor and legislative leaders, they hashed it out and said, we're going to give the governor tools to control these costs, but ultimately it's going to cost taxpayers somewhere, be it from hospitals having to pick up the cost ultimately and then handing that down to health consumers, or going to the state for more taxpayer funds. Well, I reached out to one of the organizers of a protest in Chicago where the migrants were protesting the governor's move to limit this program in a cost control way. And Tovia Siegel, she is with Healthy Illinois Campaign, chatted with her on Friday and asked her about Friday's protests.
Yeah, so today a group of grassroots organizations, immigrants, healthcare providers, and elected officials from the city level in Chicago, as well as Cook County and the state level, gathered to demand to Governor Pritzker that he reverse his recent decision to close new enrollment for immigrant health coverage programs, as well as instituting high copays, exorbitant copays of up to $250 for the lowest income residents of the state.
So Siegel said that they were there protesting the governor's move to control those costs, but I asked her, how do we ultimately pay for this?
Sure. So I think when we talk about the cost, we need to talk about the cost in all senses. One important caveat to the how do we pay for it question is that there is significant federal reimbursement available, or federal dollars available for this program, and that's often missed in the conversations about it. So that's one way we pay for it. But we also need to recognize when we're talking about costs that this is a program that shifts costs away from uncompensated care for safety net providers. It means that our healthcare system no longer bears the cost of people who are not able to pay, and instead can provide them preventive care and primary care, like we talked about, that keeps them healthier, keeps them able to work, keeps them out of the emergency room. And so I think those are really important.
So again, Tovia Siegel, she is with Healthy Illinois Campaign. She said that federal funds should be used for it. I was under the assumption federal funds can't be used for this migrant health care costs. It's all going to be state tax dollars. And even the governor's intimated that. She says that's not the case.
That's not totally accurate. There is federal reimbursement under emergency Medicaid for anything that's deemed an emergency, which is actually a pretty wide range of medical services. So regardless of immigration status, emergencies can be reimbursed by the federal government, as well as pregnancy and 1 year postpartum. So there are federal dollars available, and we as advocates want to ensure that the state is capturing every single federal dollar available. We haven't yet seen evidence that they're doing so, and so we would also call on the state to ensure that they are getting all of the money that that's there, and that nothing's left on the table.
Well, and just a note here, as we re-air this conversation I had with Tovia Siegel on Friday, you've got Save the Humans on YouTube saying federal dollars are coming from the same people. So stop saying it's better. He's absolutely right. It's not just money out of thin air. Federal dollars are your tax dollars. You're paying into that. So regardless, tax dollars are going to be used for this. But what about in the state tax dollar realm? $550 million is the cap. Where do we go if that is reached and exceeded? Again, Tovia Siegel from Healthy Illinois Campaign.
So that's more than we've spent in previous years on the program. That's what we believe should be sufficient, and we want to make sure that that's spent on the program. We're definitely not at that cap yet, and we think that the program should be fully implemented now, and then we'll continue advocating for future expansion.
So she says they're going to continue advocating for future expansion. What, beyond those who are 42 years old? Here's Tovia Siegel.
Yeah, ultimately we do want all ages, regardless of immigration status, to be covered. These are low-income immigrants, many of the most hardworking and, tax-paying, dedicated citizens of Illinois, but also many of the most vulnerable. And they, like everybody in the state and in the country and in the world, should have access to the health care that they need.
So while Tovia Siegel with Healthy Illinois Campaign was talking about the protest happening on Friday, just days before in the Chicago City Council, you had residents complaining about the $50+ million the city's going to give to migrants' shelter, plus all the other costs that there are that taxpayers are subsidizing for the migrants. You had the black community in Chicago upset. They felt like they were being left behind. I asked Siegel to respond to those concerns.
Yeah, I would say, and I work particularly in expanding health coverage to immigrants, and that's something that benefits everyone, whether they're an immigrant or not, whether they're an immigrant who's been here for 20 or 30 or 40 years, or not, because when everybody has access to the health care they need, we're all healthier. But also, when people have access to the primary and preventive care they need, the health system is more stable and stronger for all of us to receive health care.
So again, that was Tovia Siegel talking about the protests in Chicago Friday, protesting Governor J.B. Pritzker's cost control moves to try to limit how much taxpayers are going to have to pay for the health care subsidies for undocumented migrants and asylum seekers in the state of Illinois being transported from the southern U.S. border to Chicago. And I don't think we're going to, hear the last of that anytime soon, as those costs will track them as they continue throughout the next fiscal year. What ultimately happens after that $550 million threshold's met in the state budget.